Good afternoon. Thank you to LeaRRn and CoStar for the invitation to speak at the 2021 Institute, Shaping the Future of Telerehabilitation Through Research. I'm Owen Lennon, a physical therapist by training and director of clinical outcomes for professional physical therapy. Today, I'd like to take some time to describe our pre-pandemic thoughts, our response, and our plans for the future as it relates to telehealth care delivery within our organization. Professional physical therapy was founded in 1999 and is an in-network practice which currently has 190 locations across 5 states, namely New Jersey, New York, Connecticut, Massachusetts, and New Hampshire, and has grown and built through partnering with best local PT practices. We offer services throughout the patient journey, from pre-surgical and prehabilitation services to ambulatory surgery center services, home care, and outpatient PT services, and of course, the reason why we're here today, telehealth throughout this continuum of care. A quick shameless plug, we also have an orthopedic clinical residency program in partnership with New York Institute of Technology and a manual therapy fellowship program in conjunction with Boston University. My marketing team would tell me I'd be remiss to not mention that you can visit us on professionalpt.com or via LinkedIn, Instagram, Facebook, Twitter, or YouTube. So let's start with a discussion of our pre-pandemic mindset. In early 2019, we were looking to provide an option for patient convenience along with continuing to provide an exceptional client or patient experience. Due to traffic, work demands, and some limitations in access due to New York City and tri-state metro area challenges, we chose to work with a vendor called PhysiTrack, instead of the old school stick figures that some of us that have been around a little while might know as it relates to home exercise programs. PhysiTrack has new age home exercise program content, patient engagement solutions, and telehealth, including streaming videos and screen sharing ability, all rolled up into a single solution that we were able to fully integrate with our EMR. We were able to white label this solution in a patient-facing app well in advance of the pandemic, and we were able to get it rolled into the Google Play and Apple app stores. In conjunction with the healthcare shift away from fee-for-service and towards fee-for-value or value-based care, a low-cost, convenient patient and provider option that was safe, effective, and would allow for the same great outcomes seen in our brick-and-mortar locations sounded really promising. While the time afforded this afternoon precludes a detailed literature review, safety and positive outcomes have been well described with the use of telehealth. Implementation, however, as is sometimes the case, proved to be challenging. The home exercise program and patient engagement solutions took off like crazy. However, we were quite limited with telehealth ramping due to payer policies and patient adoption due to a perception of the essential component of manual therapy or hands-on treatment in outpatient orthopedic physical therapy care. Then along came COVID and the lockdowns we've become all too familiar with. Thankfully, much of the infrastructure was in place when these scary days of early March 2020 came along. A remarkable collaborative team effort spun up from a comprehensive formal training program delivered via Zoom webinars and on our learning management system within 24 to 48 hours. And of this, I'm really proud. We discussed the patient and client resources needed both from a technological and equipment perspective. We discussed HIPAA, patient privacy and compliance concerns. We spoke to safety and emergency procedures. Is the patient's home unlocked if you're providing a telehealth service and they fall and need emergency services? Is there an appropriate emergency contact in place that has access to assist the patient in the event of an emergency? We discussed best practices, adaptations, tips and tricks, do's and don'ts, as well as ethical legal considerations. And we did our best to summarize and provide up-to-date billing practice guidelines, which the best we could given the ever-changing environment. We subsequently delivered over 30,000 telehealth visits in the following months. We quickly wanted to assure the quality of our care delivery across the practice and limit any unwanted variation with respect to our outcomes as everyone worked to find their new normal. Our clinical excellence team, which is comprised of 8 of some of the most intelligent and passionate clinicians I've had the pleasure of working with in my career, came together and created the Professional PT Telehealth Certified Provider Program. To be eligible for this program, a provider must have greater than 1 year of clinical practice experience, have performed 15 or more telehealth sessions, acknowledge review of our policy and procedure manual, and pass a written as well as a telehealth practical exam with a member of the Clinical Excellence Department. To date, I'm proud to report that we have more than 30 providers in the organization certified with this designation. We diligently worked through the challenges associated with the new demands on our IT infrastructure, along with the ever-changing payer requirements. An example is a workers' comp payer who required all telehealth sessions for their members to be billed or coded using the physician E&M code 99212, which subsequently created challenges with our Medicare MIPS reporting. As far as IT, we really faced some big challenges. What had previously been a very controlled environment of user access, dedicated systems, and data, API, and app integrations was now thrust into an even more enormous level of complexity with users accessing systems from home. These secure access systems had been in place prior, but were placed on much greater strain as more users assessed them in less defined time patterns. The age of our network and opportunities for optimization became clear, and we ended up accelerating our capital IT infrastructure commitments. Dependence on home internet service providers or cellular provider network access and performance to assure stable connections frequently caused a blame game to ensue with regard to who was at fault if quality was not at the desired level. Troubleshooting these issues frequently became a needle in a haystack type game without the ability to replicate the connectivity or bandwidth strains at the time of the error. We were able to develop exception reporting to track logs to expedite tech support related items, but I've got to be honest, there were many long days where I learned far more about bandwidth and technological constraints than I ever would have imagined. Internet connectivity in the home for our providers and for our patients frequently proved challenging when networks were stressed with these bandwidth constraints. We frequently saw Netflix, Zoom, Xbox Live, or other bandwidth services being used simultaneously, which for many users was not the case pre-pandemic as work from home became the new norm. As a result, there was a real large influx of tickets to our IT help desk, which needed to be addressed and caused significant early frustration for some users. As our volume of telehealth visits increased and the IT conditions stabilized and a comfort level with telehealth care delivery was recognized, the next question became, how are we doing? Are our patients seeing the progress we would expect? Thankfully, through our EMR integration with Photo, focus on therapeutic outcomes, we were able to continue to capture outcomes data throughout this enormous practice shift due to COVID. Mark Wernicke, Daniel Deutscher, and Deanna Hayes of Photo published a study that analyzed 4,000 episodes of telehealth that mirrors the data that I've seen in our practice with a much more interesting infographic than I ever could have created. They analyzed these 4,000 episodes with telehealth sessions that fell into 4 categories. 1, any level of telehealth utilization. 2, less than half of the visits. 3, most of the visits. And 4, exclusively telehealth. Propensity scoring methods, simulating randomized control trials, were used to match patients with and without telehealth administered during their course of care. Their data, along with ours, suggests telehealth is effective and perhaps slightly more efficient than standard in-office visits. Episodes involving telehealth had an average of 2 to 3 fewer visits. Both telehealth and non-telehealth episodes were equally effective for improving functional status, regardless of the percentage of visits performed via telehealth. And I believe that Mark and the folks at Photo have this pending formal publication shortly. So, what does the future hold? You'd have to be living under a rock to not feel the downward pressure being placed on therapy services by increased insurance payer use of third-party utilization management services, all the while raking in billions of dollars in profits for their shareholders. It's another far greater than 15-minute topic to address here, but it's clear, in my opinion, that value-based care, or some iteration of fee for value, is here to stay and will become increasingly leveraged in the rehab space. It's the only currency we have to combat further reduction in payment for our services and in our practices. At Professional PT, we intend to continue to build out our educational and training programs to ensure best-in-class therapy services for our patients. We will continue to provide structured, repeatable mentoring programs and use outcomes data to qualify our success and guide our continued efforts. With IT-centric systems integration and data leveraged decision-making, we can best serve our clinicians and patients' needs and continue to be nimble as we navigate the ever-changing healthcare environment. We intend to continue to participate in value-based care contracts and with our ACO partners as a low-cost provider, providing exceptional outcomes, limiting downstream healthcare utilization and opioid use, as has been clearly demonstrated in these literature, in the literature noted here. These are just a few articles that have been very impactful in the rehab space, and telehealth services in conjunction will continue to strengthen the narrative to the entire healthcare community as a whole. In conclusion, I wanted to take a moment to share this illustration from July of 2014 from healthcatalyst.com, which nicely highlights what they term the revenue transition period from fee-for-service to value-based reimbursement. Notice there's no defined time on the x-axis, as this process has been very slow-moving and will continue to take a great deal of time. I believe it's clear that telehealth can and should provide a reasonable means of access for patients to receive quality services. However, whether payers decide to reimburse telehealth at parity to in-office visits in the bridge to true episodic or value-based care delivery remains to be seen, and in my opinion, will likely be the primary influence on widespread market adoption of telehealth. 2014 to 2021 is quite the time. This revenue transition period is going to take even longer, I fear. Thank you for your time and attention this afternoon, and I look forward to the question and answer session in the live panel discussion. My contact information is provided here should you wish to connect. I wish everyone a happy, healthy, and safe 2021, where we can return to some semblance of normalcy, whatever that new normal will look like. See you next time. Thanks.